Healthcareonomics, changing healthcare by changing the way you think about healthcare. Hey, welcome to the Healthcareonomics podcast, everybody. I'm Dr. Kevin Wacasey, your host, and joining me today is Tom DiLiegro, one of my favorite guests, the guy who helped kick off this podcast series, Healthcareonomics for Employers. Tom, thanks for coming on the show. How are you doing today?
I'm doing great. Always a pleasure to be with you. I look forward to these podcasts, so thanks for
Great.
having me back.
Great.
I forget your secret. You asked me back. I had a Rotary Club that asked me back. I got to invite my wife, and you guys need to tell her what makes you keep asking me back on, because I could use some help.
Well, nobody. No, I'm not going to say that. No, I've got plenty of people who'd like to be on. But yeah, Tom and I follow each other on social media. We have a lot in common. Tom is a benefits advisor with, tell us your company name again.
Benefit Advisors of Charleston.
Benefit Advisors of Charleston. That's of Charleston, South Carolina. But he does work across the country, and I'll have information on how you can contact Tom and links to all his services below when I publish the video. But today, what we planned on talking about, something happened within the past week that made the news, a little bit made the news, but I wanted to get Tom's perspective on it and have him explain it to everybody because I think it's huge, and it is this. President Trump has signed an executive order expanding the use of HRA'S within the health insurance world. And so, Tom, why don't you tell us what an HRA is, and then let's get into what President Trump's executive order means for employers and their employees out there.
Sure. So an HRA is nothing more than a provision in the tax code. It was part of the 1952 or 54 Revenue Act signed into law by President Eisenhower, which pretty much gave every employer the ability to reimburse on a tax-free basis qualified medical expenses.
Okay.
And it was been in existence for 60 years, very underutilized, which I'm sure we'll get into later on in this podcast.
So that's what it stands for then. That's what a HRA is, a health reimbursement account, correct?
Arrangement. One of my biggest pet peeves is when people, and I saw one the other day, the Wall Street Journal called it a health reimbursement account, and I cringe and I go, no,
it's an arrangement.
It's an arrangement because there's no account. It's a commitment to pay. You don't actually pay until somebody incurs a qualified expense.
Okay. So this separates it from the HSA that hopefully most of our viewers are familiar with, the health savings account, which is a great thing to have. It's a great way to spend your money on your health care tax-free. Tell me this before we get into President Trump's recent action. Is it possible for an employee to have an HRA and an HSA in the same?
Yes, they can't overlap. They just can't overlap. The qualified expenses I refer to are 213D expenses. And anybody can go out and Google section 213D, and there are thousands of things that are considered qualified healthcare expenses that can be reimbursed for or paid for using HSA dollars. So long as you don't use.
Who would make that decision? Who would make that decision on whether you pay for it with your HSA pre-tax dollars or whether the employer pays for it with the HRA?
Therein lies the rub. That's why they're called consumer-driven health plans. They're consumer-driven accounts. So you and I and everybody who uses these accounts are expected to know some of the provisions of the tax code. Otherwise, there are major penalties if you overlap what you use an HRA and an HSA for. So you could have what's called a stacked account, and so long as the HRA doesn't reimburse anything below what qualifies a health plan as being HSA qualified, then you can absolutely stack them together.
Okay.
Yeah, so we're getting into benefits like level 301.
Okay, gotcha. But basically, the bottom line is if you are an employee and you work for an employer who offers both HRAs and HSAs, I think it's fair to say that you should be working with your employee benefits folks, your health benefits folks within your company or your advisor outside the company to maximize the savings that you would achieve both through the pre-tax dollars afforded you by your health savings account, as well as the ability for your employer to reimburse certain of your medical expenses over and above the health savings account with their dollars. So so that's what an HRA is, a health reimbursement arrangement. So let's get back to that again. So the HRA, tell us what did President Trump do recently that is such a big deal? Why the news around these HRAs?
So again, based on the original tax law, this is essentially out-of-pocket medical expenses, what the HRA was intended to be used for.
Right.
Medicare Modernization Act came into play in 2002, which more strongly tied the HRA to a traditional group health plan. So since 2004 or so, people have always associated out-of-pocket deductible and out-of-pocket expenses as part of a group medical plan to being things that can be only tied to an HRA.
So let me interrupt you there and just clarify for the listeners who don't understand. So around 2000, as I write in my book, The Guide to Buying Health Insurance and Healthcare, around the turn of the millennia, health insurance companies started raising deductibles. To me, that's an effort for them to increase their profitability by paying for less of your health care, but you're still on the hook paying them. They didn't go down their premiums much, if at all, but they went up on the deductibles. So they shoved that out-of-pocket responsibility. They increased that on the behalf of the patients. Now, what happened there is since that started creeping up, what you're saying is the HRA is something that is really designed to help cushion that blow, because if you have a $2,000 or a $3,000 or a $5,000 deductible offered through your employer-sponsored group health plan, which that's what employer-sponsored health insurance is, if you have that high of a deductible, then through an HRA vehicle, your employer will actually pay for those qualified healthcare expenses. So let's say you have a knee replacement or something, and you blow through the $5,000 deductible that you have through your group health insurance. You're saying that if you have an HRA through your employer, then the employer will pay $5,000. They will pay, or they should.
Yeah, it's referred to as buying back the benefits, right? So you buy an inferior or perceived inferior health insurance plan with a very high deductible. You save on the premium, creating a delta. And the HRA is money that's thrown back at that deductible to make it look less than the actual insurance product that was purchased by the health insurance company. So I would say that the advent of HSAs and HRAs actually poured gasoline on the fire of exploding out-of-pocket expenses, because the health insurance company said, "What? You can just put in an HRA. It's called consumer-driven health plans, so we're going to jack up our deductibles for the plans that we put on the market." Intent being was premium A, current new premium B, create that delta, which gives a pot of money that they can then throw to the out-of-pocket expenses as a part of the deductible.
So I'm thinking of an interesting question here that just popped into my mind, and that is, because I'm a huge advocate, if you want to save money on your health care costs, one of the best ways of doing it is really hiding the fact. I'd like to say that you should lie and hide the fact that you have health insurance when you go into a facility. Like, for instance, if you go into a place and ask for an MRI, if you offer to pay cash, you might find that MRI. Hopefully, you should find that MRI for a few $100, and you can get it right then and there. If you try to get it through your health insurance, it's going to be significantly higher, often in the thousands of dollars range.
Exactly.
And if you have a high deductible health insurance plan, then that means that either you or your employer is going to be on the hook for those thousands of dollars. So here's the question I have, now that I've set the stage. This all is very complicated, right? That's why we have these podcasts. But here's the question I have for you. Let's say that I have health insurance with a high deductible, $5,000 deductible. I have an HRA that's paid through that promises to reimburse me through my employer for qualified medical expenses. But let's say I want to be a nice guy and I want to save my employer money. I want to save money myself. I don't want to file it on my health insurance. So I'm going to go to the imaging center, and that $5,000 MRI, I'm going to get it for $500. $500, a tenth of the actual price, not the cost, the charge. So could I then submit that? I know that I can submit that to an HSA. Can I not?
Good.
I know I can submit that for an HSA for reimbursement, but can I submit that to my employer under the HRA?
It depends.
Okay.
It depends. So it depends if you have an independent fiduciary third-party administrator pushing the paper on those claims.
Okay.
If a health insurance company is administering that HRA for you, heck no, they're never going to allow you to carve that out, because again, it's what's in the language of the HRA plan document. Right. If they say we're going to reimburse deductible expenses, then the answer to your question is no, because again, they're trying to drive people to use their plan.
I got it.
If it's an independent, freestanding HRA administrator, and you have a savvy broker like myself, and you can say, well, we'll reimburse any 213D expense not tied to the deductible. Then, sir, you can have that HRA reimburse all out-of-pocket expenses, and you incentivize them to exactly ask for the cash price, because that HRA can then be used to reimburse that 213D expense, not necessarily a deductible.
Gotcha.
See, all deductible expenses are 213D qualified. Not all 213D expenses are applied to your deductible.
I understand.
Right?
So basically, savvy employers would be wise to investigate who's handling this. And what you're saying is, if a third-party administrator is handling the health benefits, administering the health benefits, then it's more likely that an HRA arrangement could be used to reimburse the employee in this regard.
Correct.
But if you're turning it all over to a health insurance company, yeah, fat chance on that, because they want to keep it all in-house. And here's my take on this, my conspiratorial take, is they want to keep everybody hooked on health insurance. They want to keep it all in-house as much as possible. The health insurers do not want you setting foot outside, because once you do, you see the wide world and you say, hey, wait a minute, maybe health insurance isn't such a great idea after all. Not that I'm advocating dumping your health insurance, folks. Not at all. But there are alternatives, and there's many, many different ways to skin a cat. And having a $200 deductible with a $5 copay for your employees these days is ludicrous, and you shouldn't be doing that. So people like Tom, or why I have people like Tom on the podcast, is to help out with these ideas to start. As I say, Healthcareonomics is changing healthcare by changing the way you think about healthcare and health insurance in particular. That's what we're talking about today. So let's get into the whole President Trump thing and what he did, and how is this going to change the landscape of what HRAs are and how they work?
Yeah, so what ultimately all he did was, or the Internal Revenue Service, was change the tax code to allow for the same tax treatment that an employer would give employees through a group health plan, and allows them to use that same tax treatment to give employees money to buy individual insurance.
Okay, so let's unpack that a little bit. So explain what you mean by tax treatment.
So if you have a group health plan, it can be an above-the-line deduction via Section 125. So that premium comes out of your paycheck tax-free.
So nobody pays taxes on that. The employee,
correct.
The employer, they don't pay taxes on that. Okay.
Correct. On the individual market, prior to this ruling, you could buy individual insurance, but the premium payment that you would pay to the insurance company is a below-the-line deduction. It's an after-tax expense. So there was a disparity between how insurance was treated, purchased through an employer versus insurance purchased on the individual market by an employee.
Yeah.
So all the HRA language that came out recently did was say, okay, you can take tax-free employer dollars in the form of an HRA contribution and make it available to employees who happen to buy individual insurance coverage.
Okay, yeah.
Creating tax parity between individual insurance purchasing and group insurance purchasing.
Yeah, so Rich Weinstein and I, we went over this in an episode of ObamaCare Exposed about how ObamaCare, the Affordable Care Act, was set up with the intention being, the very sly intention being, to eventually get people off employer-sponsored health insurance plans because they're not being taxed. Because the IRS is missing out on tax revenue because of that. And we guessed, now perhaps you know the answer better than we did, but we guessed that each year the IRS is getting hit with approximately, I want to say it's $300 billion. I forget the number.
Yeah, I take issue with that. I mean, that assumes it's the IRS's money.
No. But what I'm saying is that they're missing out on hundreds of billions of dollars in taxable revenue based upon this rule. What is the rule that created this? I forget. It was after World War II. There was a certain rule that said health insurance premiums paid by employers are tax-free. Nobody pays taxes on it. There's no corporate tax on that money. There's no employee tax on that money. So as long as you're an employer and you offer your employees health insurance, you get it tax-free. You pay the premiums. It comes off your, as you say, above-the-line deduction. Well, that's very unfair to us individuals and small business owners who purchase our own health insurance because we got to pay the taxes on it.
Correct.
And that's a huge way for the health insurance company, the health insurance industry, to keep people in the idea, or to keep people in the corral, if you will, of group-sponsored or employer-sponsored health insurance plans, which I think is bad because it doesn't promote competition. It doesn't promote a lowering of premiums. And we've talked about that before. But what the architects of Obamacare did was they said, okay, we're going to use this thing called the Cadillac tax. And we're going to start out high, but we're gradually going to increase. As premiums increase, the Cadillac tax is going to slowly increase, but eventually these things are going to reach a matching point where so many employers are going to have to get hit with this Cadillac tax. They're going to throw their hands up and they're going to say, hey, listen, folks, here's some money, go buy your own health insurance. And then that shifts those people.
Well, see, even there was a provision in the Affordable Care Act that disallowed that they couldn't, you couldn't commingle employer dollars with purchase of individual health insurance.
Oh.
So there was a provision that didn't allow that. I remember in 2014, even further, 2010, we thought this was going to be the end of employer-sponsored insurance, and employers are going to just give them a stipend, and everybody was going to go to the exchange and buy their health insurance on their own, and the benefit was going to be the employer contribution. But I think it was the Department of Labor, if I'm not mistaken, or the IRS, I can't remember which agency, said, you can't do that. We're not going to allow that because we're not going to allow you to commingle employer and employee funds when it comes to the purchase of individual insurance. So again, this is just, as much as it is a directive to allow HRAs to buy individual insurance, it's almost as much a rollback on that original provision by the DOL or IRS from 2010, which disallowed it.
Wow. So I'm wow. There's a lot to unpack here. So let's get this straight. Let's set the stage. Make it clear. Employers have been incentivized since after World War II to provide health insurance for their employees.
Correct.
Because they pay that money to XYZ health insurer tax-free.
Biggest tax write-off
in the country, in the nation, because that's what I alluded to earlier. The Treasury misses out on, if I'm not mistaken, it's hundreds of billions of dollars a year in taxable revenue that get shunted into health insurance premiums. Well, I know that it's probably $1 trillion a year that gets spent on health insurance premiums by employers. So, hundreds, $300 billion a year in actual taxes that would be realized by the Treasury is getting every year because of this rule that's been around since the 40s. So Rich's point was in the ObamaCare Exposed podcast that the Cadillac tax was going to try and get employers to shunt people into buying their own health insurance, either employer sponsored, either employer paid for, or employee individual paid for. And as a result of that, more tax revenue would be coming in to the Treasury every year.
Correct.
But now you're saying that what President Trump has done via an executive order is he's not only expanded HRA availability for people, but tell us what he's done regarding that tax issue. Are you saying now that individuals are going to be allowed to go out and buy health insurance policies and not with pre-tax dollars?
With employer dollars. No, the employer contribution. Because the only way to do it before this regulation was a gross up of salary. Hey, your health insurance, we think in this market, based on where you're located, is averaging about $300. So we're going to gross up.
Wink, nudge, not what I mean. Here's
you can't
the
call
money
it
under
health
the table.
Insurance. You can't call it a health stipend, but we're going to give you a raise, $300 a month. Right?
Okay.
And we're going to ask you politely to use it for health insurance. Now, you can't make employees buy health insurance with it, but they increase their salary or hourly wage by $300 a month. That subjects that increase to payroll taxes, right? The 7.5% payroll tax. And so all the provision now has done is said, hey, you can give that employee $300. You can actually dedicate it to individual health insurance reimbursement, and that contribution that you're making for them is not subject to payroll tax.
Wow. So let me get this straight again. So now what President Trump has done is said that employers, guess what? Now you can instead of playing this game of under the table and wink, wink, nudge, nudge, now you can hand your employee an extra amount of money and say, here, go forth and buy your own health insurance plan.
Correct.
It's on us. here's an amount of money, and it's not taxed. Is it the same as existed since World War II, where nobody's paying tax on that, not the employer or the employee?
That's correct.
Wow. Okay, that's pretty huge. I think that's a great shakeup.
And frankly, if you ask me, that's how it always should have been. Right? We wouldn't be in the mess we're in now if that's how it was from the beginning.
Yeah. Well, I'm all about tax deductions and everything else. So yeah, I think that if health insurance is tax free for a certain group, it ought to be tax free for everybody. Now, how many people across the country? I've heard estimates on the news in the millions, 15 million, something like that. The projection
is like 11 million people could be impacted by this in a positive
11
way.
Million employers or employees?
Employees.
Individuals. Why so few?
Well, very good question.
Is it just that is it just not that many employers offer HRAs these days?
Yeah, I think the biggest draw is going to be your small mom and pop employers who are trying to retain employees. And frankly, a lot of people, even when it came to full enactment of Obamacare 2010, 2014, a lot of employers who have figured it out said, listen, we've done this forever. We're not going to pull back.
Yeah.
You like what we're doing, despite the cost, right?
Right.
But we like taking care of our employees, so they weren't impacted. They were going to roll with the punches and continue doing what they were doing.
Gotcha.
So I think the projection is small because we're estimating that it's primarily going to be small employers.
Yeah.
And it's going to be those people who maybe kicked the tires on offering a group plan but never had the wherewithal to do it are now going to be pushed over the edge to where they're going to say, yeah, sure, I'll give them a tax-free stipend, no problem. The interesting thing about it, because when this was going to be rolled out and it was accepted that this might be the wave of the future, there were a lot of studies done right around the time the Affordable Care Act was passed. And I think the average contribution was estimated, and my memory's fuzzy a little bit, but I think it was like $280 on average. Mm-hmm. And if an employer was going to give $280, employees were actually going to go out and not spend more than what their employer was going to give them.
Right.
So you mentioned earlier, by competition, and frankly, that's almost my fear. This is a very good step, but it almost is going to drive people to very low cost, and people are going to shop the price and not pay attention to the benefits that they have.
They're going to become consumers,
which
may or may not be a good thing. But if there's one thing that we hope this does, is it starts to lower the price, lower the premiums of these policies, as health insurance companies have to start competing for individuals' business.
Yep.
And wow, so this is, along with the association health plan stuff that President Trump did, I think he's really taken a few jabs, maybe even a good cross with this one, body blow to the health insurance industry. Of course, they don't want individuals. I mean, I see this as a win-win actually, because the health insurers, as long as the employer is perceived to be paying for it, which the reality is the employees are missing out on a raise because the employers are paying for their health insurance. But as long as the employer is handing money out to the employee, the employer is incentivized to do it because they still get the tax write-off. The employee is incentivized then to go out and buy health insurance, as opposed to just giving them some money under the table, wink, wink, nudge, nudge, and giving them money under the table, which they can go out and buy an Xbox with or whatever else they want to. So now the employees are going to go ahead and buy health insurance plans on the open individual market. I just see it as a win-win-win. The health insurance industry still gets business because, unlike, if left up to people, I mean, I like to throw around the statistic. What do 90% of people who don't have health insurance also share in common? They work. They have jobs, but they either work for a company that doesn't offer it, or it's too expensive for them to buy it, or a significant number of those 90% who don't have health insurance just choose not to buy it. They say, it's not worth it. I need to get this. I need to do that. I need to do this. And so they don't buy health insurance. So I see it as a win-win-win all around. So really, the HRA thing, so here's my question for you. So now, for the first time, I guess ever, we're now saying that employers, since the advent of HRAs, have been able to share, they've been able to commingle employer-employee dollars as far as health care costs through the HRA. But as I like to say, health care ain't health insurance, two totally separate things. So now you're saying that really for the first time, the employer and employees can commingle money as regarding health insurance costs as well. Correct? And so is this, Yeah, is this falling under the HRA provision, or is this called a new thing, or what is?
Well, there's something right now called a QSARA. It's called a Qualified Small Employer HRA.
Okay.
That has limits. So thanks IRS for giving that opportunity back in 2016. But much like they always do, what they give, they take two steps back.
Sure.
There are caps on what employers can contribute to a QSARA, and they limit what you can spend it on. So in this case, on a QSARA, you can use it for health insurance premiums or out-of-pocket expenses, or both.
Out-of-pocket expenses for health care?
Correct.
Okay, gotcha.
Section 213D, like I mentioned earlier.
I see.
But they were subjected to certain caps, right? From what I understand in the most recent legislation, one, it's not limited to a small employer, 2 to 50, and it's not limited to an employer that does or doesn't offer group health insurance. So It's just giving another avenue or channel for employers to provide tax-free money to afford health insurance premiums.
Yeah.
In this case, specifically on the individual market.
Wow. I think it's a huge boost. It's a huge
win
for everybody involved. Now we'll see how much it takes off, because it may be available to 11 million people, but I don't know that most health insurance brokers and benefits advisors out there are going to really latch on to this. If they're smart, they will. But, a lot of them are still making money off the good old-fashioned status quo. And
there it is. Yeah, exactly.
So 11 million potentially affected. It'll be interesting to see how many shake out. And that's why we're doing this, is to get the word out and get employers thinking differently. Because you need to find somebody like Tom. You need to find somebody who will help you save money, who works with you to save as much money as possible, and who's completely honest and upfront with you. Tom, I love you. So let's say this, that how is it that President Trump is able to, pun intended, trump Obamacare and established law passed by Congress? How is it that he's able to cross that line with the separation of powers and everything else constitutionally? Is this a constitutional thing that he's done with this executive order?
It's an administrative function.
Okay,
the IRS and DOL fall under the executive branch, and there was a comment period, and he just exploited his ability under the legislative powers of the administrative state to change some provisions in the tax code.
Okay, so let me clarify for the viewers. When I went to law school for a year, I'm not a lawyer, okay? But one of the most fascinating things we discussed was the fiction and tyranny of administrative law, and that is we elect Congress every so often. We elect representatives and senators who are our supposed legislative body, right? And they pass laws that have the force of law throughout the United States. Well, unfortunately, in the early 20th century, I think it was, the executive branch under the president's office started creating all these administrations like FDA and USDA and what are some of the others? EPA, Department of Education, created under Jimmy Carter. I mean, and all these administrations pass rules and regulations by, let's call it what it is, the deep state bureaucracy. They get to pass mounds and mounds of rules and regulations that have the force of law, and yet they're not passed by any elected representatives. So really, we don't live in a representative or constitutional republic anymore that's represented, where the laws are passed by our elected representatives. Yeah, it's very sad. John Stossel does a great job of exposing this and showing just piles and piles of rules and regulations that get passed every year. So basically what President Trump has done is, what you're saying is that Congress passed Obamacare, and it has the force of law. But implementing that law, enforcing that law, falls to the IRS, correct? And
so in Obamacare, and I've read every page of it that came out, but I don't know how many times it says,
Alka-Seltzer, please.
In there it says, I don't know how many hundreds of times, the secretary shall.
Yeah.
And the secretary shall pertains to the HHS, Health and Human Secretary.
Who falls under the executive branch.
Correct. So it says the secretary shall ... Right?
Okay, right.
And the secretary shall, whatever comes after that, is enforced by the IRS.
Correct. So what President Trump has done is said the secretary shall not. basically.
It's essentially, right? They took a comment period. They took in comments from everybody.
Right.
And then they said, okay, here's what the secretary shall do. We're going to allow this, and it's going to be enforceable by your local friendly IRS agent.
Absolutely beautiful. So as far as we're concerned, it's going to stand the test of time. It's constitutional. There's really little danger, if any, of it going away anytime soon.
And it kicks off January of 2020, so this next open enrollment period. If you're working with an agent or an advisor who's not saying to you, hello, Mr. Small Employer, instead of taking your 20% group increase, fix your cost to this, ask your employees to go out on their own and buy their own health insurance, and your cost is whatever you would like it to be. Now, like you and I have talked, the other piece of this is the insurance still sucks. So what we have to do now is pick up and say, hey, individuals, not only employers, pay attention to what you're buying.
That's right. And that goes to my point of that goes to my point of, hey, man, you got to do everything you can as a healthcare consumer, as a patient, to save money, even if it means saying I don't have health insurance. Well, Tom, it's been great. Thank you so much. And one thing I do want to say to everybody before we go is that what I just said about this new rule, this fantastic win-win-win for everybody, it seems that standing the test of time, it may only last until January of 2021 if we don't do the right thing and vote for the right person to lead us for the next 4 years. So please, everybody take to heart what President Trump is doing to help lower your health insurance and your health care costs. It's phenomenal. And unfortunately, he's having to go around Congress to do it because they are not incentivized to do it, but he is. So, Tom, thank you so much. I hope you'll come back. Please.
Absolutely. Thanks, Doc.
Let's not be strangers. So, until then, everybody, stay healthy.
Now you can easily compare health insurance plans and pick the one that makes the most financial sense with the Dr. W's Equation app, available for Android and iPhone. And for more information on how you can save on health insurance and health care, check out my books, available now on Amazon, iTunes, and Nook. To help spread this message, please click the like button on this video. You can also subscribe to the Healthcareonomics YouTube channel and visit healthcareonomics.com.